Welcome to our Whole Woman's Health of Austin Clinic. Immediately when you walk into our clinic, you'll notice that we are dedicated to eradicating the stigma surrounding abortion care. You'll notice that we have really bright purple walls in our clinic, and along with our smiling faces in each room, you'll also find a quote from a woman that has done something very strong and powerful in history. This room is our front lobby. This is our Ann Richards room. Ann Richards was once the governor of Texas, a very powerful woman governor of Texas, who was really dedicated to women's rights and the fight and the struggle for women's rights here in our state. We thought that it was only appropriate that the first room that you walked into was named for her. Once you walk into our clinic, the next thing you'll do is sign in at our front desk here with our front desk staff. This is our front desk. All of our patients that come into Whole Woman's Health first will sign in here at our front desk. First thing you'll notice is that the windows are very open. We try not to create a barrier between our patients and our smiling staff. That's to help eradicate the stigma that surrounds abortion. Every patient will sign in and receive paperwork. Once that paperwork is finished, the next thing that we'll do is we'll take our patients back to lab where we'll get the process started. This is our Maya room, our Maya Angelou room. It's also our lab. In our lab, we're going to run lab work on each patient. Normally we're going to draw 2 tests, an RH factor and a hemoglobin on each patient and send to an outside lab. So much happens in this room, usually because it's the first place that the patient gets a one-on-one interaction with our staff. So a lot of questions happen in this room, questions gaming from how long am I going to be here today, all the way to how the actual abortion is performed. So our staff here in lab are very versed in our counseling and very versed in the process that happens throughout our clinic. Once we have a patient's blood drawn and we're ready to send them out to the lab and we've asked all of those questions, the next thing we're going to do is their sonograms. We're going to head over to our OR room. This is our Margaret Cho room, or our operating room. We do a few things in this room. One, we do on the first day with consultations, we're going to do the sonogram in this room. Every patient in the state of Texas is required to have a sonogram at least 24 hours prior to our abortion procedure. So that's going to happen here. A lot of explaining with the ultrasound is going to happen here. Many patients sometimes are emotionally attached to the pregnancy already, so the ultrasound is a huge step for them. So a lot of emotional counseling with the ultrasounds happen in here. This is also the room where the actual abortion is going to take place. And you'll notice that the room is pretty much set up like your basic GYN room. We have the same table, same sonogram machine. The things that are a little different is there's going to be a surgical tray in the room. That surgical tray is going to have all of our surgical instruments. And you'll notice that there won't be any blades or any knives because there's no cutting that happens during our procedure. And you'll also notice that we have our surgical aspirator machine that is used to actually vacuum and aspirate the pregnancy during the abortion. Abortion procedure normally takes about 8 to 10 minutes tops for a patient. This room is a bigger room because we definitely encourage our patients' escort and support systems to be a part of this process with them and to help them get through this. Once we leave this room after the sonogram, the next step is counseling. If you're in this room for your actual procedure, once you're done here for the procedure, we would take you to aftercare where you're going to relax there for about 15 to 30 minutes and we make sure that everything is okay. And this is our Wonder Woman room, or our aftercare room, where each patient comes after her abortion procedure. You'll notice on each chair that we have a blood pressure cuff and a pulse oximeter where we monitor our patients' vitals while they're in here for about 15 to 30 minutes before we allow them to go home. We also offer them Whole Woman's Health on blend of Tranquility to help with their cramping and also to help them be in a better mood after their procedure. We continue our promotion of being one-on-one with our patients here, offering one-on-one instructions for what to expect after the procedure and also to revamp everything that's happened over the last couple of days while they were here. And we're really proud of our Queen Hippolyte quote on the wall, which sends the women back out in the world in power, as Queen Hippolyte did with her daughter Wonder Woman. When my patients leave here, I want them to feel empowered. I want our patients to feel that while this was definitely probably the hardest choice that they've ever had to make in their life, I want them to leave knowing that they are good people, that they are not alone, and that we are here for them. I want women to feel empowered by their decision and not feel victimized by their decision.